Control of infection is a huge problem in modern hospitals, with many patients dying every year from preventable infections. The most important control is thorough and effective hand washing. It is vital to use the most effective agents, not to cut corners, and avoid careless practice. Did you know there are 400 times more bacteria on the average desk than on a toilet seat? Controlling infection by use of suitable surface cleaners is just as imperative as good hand washing technique. In this bite, we will be testing a range of hand and surface cleaners on agar plates streaked with a liquid culture of Staphylococcus aureus to determine which agents are the most effective in each case and to empirically provide a comparison. Starting with the surface cleaners, we will test both tap water and dirty water, alongside domestic bleach and a generic surface cleaner. Finally, we will include the industry standard antimicrobial agent Virkon. Turning our attention to the hand cleaners, we tested tap water and generic liquid soap. We also tested the efficacy of antibacterial soap and the alcohol wipe. Finally, we included the universally favoured isopropyl alcohol gel, also known as Purell or at Kiel, Bug Apocalypse. To make this comparison, we impregnated a series of Whatman paper discs with each of our selected agents, seen in the video in the small plates to the left. Then the discs were placed in the centre of pre-streaked Staph aureus plates so that we could compare and contrast the zones of clearance surrounding each disc side by side with the other agents in this experiment. To this end, we are using the different sizes of clearance zones of Staph aureus we will show in a moment as a measure of efficacy for each of our agents, to underline just how important it is to use appropriate compounds to control the spread of infection in both hospital and domestic settings. In June 2007, the Healthcare Commission began a programme of unannounced inspections in 120 NHS trusts to check their compliance with the Hygiene Code. The Hygiene Code, which came into force in October 2006, gives the HCC the authority to ensure that NHS trusts are doing their utmost to reduce rates of healthcare-associated infections to protect the safety of patients. In hospitals, various measures are in place to reduce the spread of infections, such as increased hand washing by doctors and nurses, the use of alcohol-based hand rubs between patients to avoid transferring bacteria from one patient to the next, and hospital wards, corridors and surfaces are regularly cleaned. As with many other infections, good hygiene is essential in helping to prevent the spread of MRSA and other superbugs, and so effective surface cleaning and regular hand washing helps to reduce cross-infection. As can be seen here, we have built up a set of plates to analyse the effectiveness side by side of the range of surface cleaners and hand wash agents we have been testing. After disc placement, plates were placed in a 37-degree incubator overnight to allow the Staphylococcus aureus to grow. It is clear that both bleach and Virkon are extremely effective surface cleaners, with Brand X coming in third place. Interestingly, both dirty and clean water had absolutely no effectiveness in controlling the spread of bacteria. Perhaps unsurprisingly, we also find that antibacterial soap and liquid soap were the most effective hand wash agents, with our Bug Apocalypse coming in third place. Interestingly, it was limited efficacy with the alcohol wipes and no effect with plain tap water. We hope this control of infection bite has provided at least some food for thought, and thank you for your attention throughout.